Hello, my name is Marisol Grullon, and we are going to go over best practices in staffing shortages, then, now, and continuing. We will be focusing on nursing for the fact that nurses are the largest group of healthcare providers, and they all work in settings where healthcare is delivered. As listed here, we see the importance of nursing. The science of nursing includes many aspects of health promotion, prevention of diseases, caring for the ill, disabled, and the dying people. Therefore, it may include direct patient care, research, policy, and education. There is a strong need for proper documentation and data collection when it comes into the nursing field. It is all about improvements as well. With nursing, we promote them to complete nursing education and to pass certain examinations and to follow certain code of conducts. This is in order to improve all around the nursing experience. There are many opportunities for nurses to advance their education. Um, we can go from having licensed nurses, registered nurses, advanced practice registered nurses, and most of these nurses enter with a baccalaureate degree, but they also have the option to continue for further licensing and for master's and PhD levels as well. With the variety of levels in nurse educations, this also depends on the kind of examinations taken and the permission to practice as offered depending on the state. Um, it is with this that they get the chance to either work independently or are still required to work under the supervision of other healthcare providers. The advancement education helps nurses to enhance their nursing administration, leadership, and clinical practices. With the continuum of changes that are undergoing in the healthcare system, there is a higher need for nursing staff. The labor force requirements in the field need a new set of skills, technology, and the provision of additional services to the patients. Most of these considerations are influenced by a number of factors that include the quality, cost, policymakers, and the expectations of the consumers. With the higher demand for nurses, we also have some reasons as to why there are shortages. Some of these may include environmental changes, advanced technologies, regulations are becoming a lot more stricter, complex requirements of services to treat different patients. There is a need for expanded roles in physical and occupational therapies, and healthcare providers also have to upgrade their credentials. These have affected the nursing profession in relation to the need, education, and the advanced practice requirements. For example, they include that the state licensing that is needed for registration and accreditation vary from state to state. Also, as competition increases, nurses have the opportunity to practice their field in many different locations. For example, we have home care, primary care, specialties, hospitals, long-term care, and etc. The long-term care facilities are increasing, seeking to recruit LPNs and the LVNs, while their demand in other healthcare settings reduced. These positions are used as the stepping stones for the higher licensure ladders. Patient care is becoming more centered on the patients and based on the community services. Like in every other field, in nursing, there are many changes that continuously happen when it comes to education and employment. Currently, there is an urgent need for advanced clinical reasoning skills. This will enable nurses to work with more complicated requirements for the patients. APRNs provide patient care by promoting healthcare, assessing, diagnosing illnesses, and managing chronic and acute illnesses, and prescribing treatment and medications as required for the patient. With many changes coming to the therapy, more healthcare professionals are actually needed. This will lead to the ability to deal with on demand. It will affect how individuals make the use of healthcare and the available facilities. Different factors affect the supply status of the healthcare workers at any time. Workforce shortages reveal that there is a need for balance between the demand and supply of healthcare workers and services provided. With the changes in the enrollment of healthcare occupational programs, we also see a larger case of people exiting the workforces, and these are also factors that affect us. The allied health professionals provide services to patients who follow the healthcare plans as set by the physician or nurse providing the services. They are involved in the provision of healthcare services that involve identification, evaluation, and prevention of diseases and disorders. This is also where we use evidence-based principles. As technology continues to advance and the healthcare system continues to expand, we do see a need for future nurses. The healthcare sector will outpace the nation's overall average economic growth rate of 3%. This is caused by several trends and themes. The age of the population is also increasing, making it necessary to increase the use of Medicaid and Medicare. As we look as the shortages affect us during the nursing field, from then, now, and the future, we can see that the healthcare system is growing at a fast pace. Wanted to say thank you so much for listening to my presentation, and these are the references that I use for this presentation.